The internet promises at every turn that you can restore your vision without a doctor, without surgery, using only exercises and healthy habits. And an ophthalmologist's honest answer is neither yes nor no. It has two parts. Some vision problems really do respond to changes in habits, and the improvement can be very noticeable. Others will not respond to any habit in the world, and every month spent doing eye exercises is simply wasted time. The whole question is which group you are in, and that is almost impossible to determine on your own, because both can feel exactly the same. To understand where the line is, we first need to separate two different things that people are used to calling by the same word: vision. The first is the eye's optical structure, its shape and length. These determine whether you are nearsighted or farsighted, and whether you have astigmatism. You could call this the eye's hardware. The second is how the eye feels and works throughout the day, whether it gets tired or not, whether it becomes dry, how easily it changes focus, and whether the image is still clear by evening. These are more like the settings, and here is the key to the whole topic. Habits work very well on the settings, but have almost no effect on the hardware. No exercise, diet, or eye workout can change the length of the eye or the shape of the cornea. This means that true nearsightedness or farsightedness cannot be naturally removed. Physically, these conditions cannot be changed by eating carrots or doing exercises. But do not be too quick to feel disappointed, because the other side is much more interesting than it may seem. There are many conditions where habits can make almost all the difference. Let us take the most common one: eye strain from close-up work. When you look at a screen for hours, a tiny muscle inside the eye keeps your focus at a close distance and does not relax. At the same time, you blink much less often and your eyes begin to dry out. By evening, your vision becomes blurry and your eyes feel heavy, so you panic and decide that your eyesight is getting worse. But it is not your eyesight that is getting worse. It is simply the tired eye running out of energy. And habits can improve this very well. Taking breaks, looking into the distance, keeping a proper distance from the screen, having good lighting, and blinking fully. We have a separate video about screens and close-up work. The link will be below this video. The point is that improving your habits really can restore clarity and comfort in this situation, because the settings needed to be fixed, not the eye itself. We should also talk separately about accommodative spasm. This is a condition in which that focusing muscle becomes so tired and tense that it temporarily causes mild nearsightedness that is not actually there. A person has their vision checked while tired, sees a minus prescription and becomes worried. But after proper rest and treatment of the spasm, that minus disappears. This is a case where vision seems to have restored itself, and that is true. But notice that it was restored not because exercises changed the structure of the eye, but because the temporary strain was relieved. It is impossible to distinguish true nearsightedness from this kind of spasm just by how it feels. That is the doctor's job. In fact, accommodative spasm is often the reason children and teenagers are mistakenly prescribed glasses they do not need. Another major area where habits truly work is children's vision, but not in the sense of restoring it. The goal is to preserve it. A child's eye is still growing, and nearsightedness can progress. Regular daylight outdoors has been proven to be one of the strongest factors in slowing this progression. A child who spends at least 1.5 to 2 hours outside every day, and a child who spends all their time doing homework and using a tablet may have two very different paths for their vision. This habit does not remove nearsightedness that is already present, but it can genuinely slow its progression, and sometimes that is the most valuable result of all. Now, let us speak honestly about the conditions where habits are powerless, because staying silent about them would be dangerous. True nearsightedness, farsightedness, and astigmatism cannot be removed through habits. They are corrected with glasses, contact lenses, or laser treatment. Clouding of the eye's natural lens, cataract, cannot be dissolved with any drops or exercises. The only effective treatment is replacing the lens. Glaucoma silently damages the optic nerve, and nothing can restore what has already been destroyed. But treatment started in time can stop further vision loss. Retinal problems and eye changes caused by diabetes are the same. This is not about lifestyle, but about getting timely treatment. And the most dangerous thing about the idea of natural vision restoration is not that exercises do not help. The danger is that a person spends months or years doing them while delaying a proper diagnosis, and the disease continues to progress quietly. This is especially critical for children, whose brains learn to see at an early age, and for older adults in whom cataracts and glaucoma can develop slowly and without obvious symptoms. This makes the main misconceptions easy to explain. The first is, throw away your glasses and your eyes will be forced to work harder and restore themselves. We have a separate, detailed video about glasses. The link is below, but in short, the eye does not recover this way. A person simply lives with a blurred image. The eyes become more tired, and in a child, this may even lead to permanent loss of visual sharpness. The second is, there are foods and vitamins that will restore your vision. Nutrition is important for overall eye health, but carrots do not change the shape of the eye or dissolve cataracts. A promise to restore vision through food usually leads only to wasted time. And the third, most misleading belief is, exercises helped me, so they work for everyone. They may very well have helped, but they helped relieve tiredness or a spasm, which means they worked on the settings. You cannot apply that success to true nearsightedness or cataracts, because those problems have a different cause. How can you tell which group you are in, and when should you stop guessing and see a doctor? The signs are simple. If your vision becomes blurry only at the end of the day and returns after rest, it is very likely related to tiredness, and better habits can help. But if your vision is constantly blurred, including in the morning and regardless of rest, if clarity gradually worsens from month to month, if you notice glare, haze, distortions, or one eye clearly sees worse than the other, these are signs that habits are not the issue. And one more important point about children. If a child squints, sits closer to the screen, or bends very low over a notebook, do not wait for it to correct itself. This is a clear reason to have their vision checked, even if they are not complaining about anything. So the most honest answer to the question, can vision be restored 100% naturally, is this. First, you need to find out exactly what you have. Is it tiredness that can genuinely be improved by changing your habits, or is it something that requires proper treatment? You cannot determine this on your own because both can feel the same. Coming for an examination at the Ko'z Nuri Clinic is the step that makes everything clear. The doctor will check each eye, distinguish temporary tiredness from a real problem, and tell you honestly where changing your habits is enough and where you need help, and exactly what kind. Sometimes the best news you can hear is that your eyes simply need rest. Other times it is finding a problem early that should not be left untreated. Either way, this is more reliable than doing exercises blindly for months and hoping for the best. You can always come for an examination at Ko'z Nuri, and your eyes will only benefit from it.